So I'm Greg Voss. I'm a massage therapist, life coach, movement coach. I work over at Quarry Chiropractic and Wellness Center here in Kingston.
Someone goes in for massage therapy with you. How is that experience going to be different from maybe a traditional massage therapist?
Yeah, so I have definitely a more heavy slant on the therapeutic manual kind of treatment perspective, and I meld a lot of movement practices into that. So I do a lot of range of motion testing and really making sure that the body that I'm working with has what it needs for what it's trying to do. So less kind of the spa setting kind of massage and much more, what is this joint doing? What is this joint doing? What are these tissues doing? How much of this is tissue? How much of this is something that needs to be trained out? And kind of putting that on the table. So I think one of the biggest things that I see coming into the practice is a disconnect between what people are trying to do and what their body is able to do presently, and what to do to bridge that gap. Because there are different things that are more joint specific and which are more learned movement patterns. And sometimes people just need to kind of a little nudge in the right direction of more towards one than the other, or how to know when to do what. One piece may be of a movement, something that needs to be trained, something that needs to be mobilized, something that is maybe just in their anatomy and is not in the, not in the cards for them. And then what do you do with that knowledge in terms of training? Not everyone can do the perfect squat or the perfect overhead press. So what is your variation of that? And kind of bringing that all together so someone has a complete training package as well as a training plan of what can we change and over what kind of time frame. As fundamental as it is, we learn range of motion testing really early as any kind of movement practitioner or any kind of manual therapist, and it really is the foundational piece of what is this body ready for. So just making sure that somebody has the adequate range. So that can be as simple as doing active range of motion testing, passive range of motion testing, and looking for what's there, what's ready, what's accessible, and what's not, and if it's not there, what's the root of that. And so there's a component of assessing not just can you hit the shape, but can you control that shape, or if you can't hit that shape, am I seeing some muscular stuff kicking in, or is this a hard bony block? Is there a pinch? Is there pain with this? Being able to suss that out and kind of take them down almost like a flow chart of, do you have enough range? Yes or no. Can you control that range? Yes or no. And eventually you'll kind of land at these spots that this is the appropriate piece for this part of the person. This is an appropriate piece that's different for this part. And then how does that show up in one movement versus another?
I've been seeing you for a little while now. We've looked at my hips, and then we've also looked at my shoulder. When you looked at those two things on me, like how did you assess them? What did you kind of determine? What did you do to address them?
Yeah, so let's look at the shoulder because that's an easy one in terms of, so if you want an overhead position, right, it's looking at if you were to lay on your back and no other parts could be brought into it, no spinal stuff, no hip extension stuff, what does your shoulder give us in an overhead position? And looking at, as we're going into that, what's stopping you? Is there a pinch at the top? Is there a huge pull through the lats? Putting your hand on there will tell you as you're going, say, through the lat, is everything staying quiet, or are you getting this neurological kind of almost like not a spasm, but a protected guarding. Anyone that's gone into a split slightly too far or fallen onto a hamstring knows like when the body kind of actively pulls back. Yeah. And you want to find that stuff, because if somebody's going on overhead and they can't make it and their lat is, say, putting on the handbrake, that's the piece that's limiting it. Versus
is that what you found on me?
That was one of the pieces that we found with you, right? And subscap, same type of thing. If you've got limited external rotation from this kind of arm forward position, is that subscap kicking in and putting on the brake? Is that something at the shoulder joint not going? And so being able to figure out that piece and going, okay, this has got a handbrake. There may be some joint stuff that shows up later, but at this current angle, your body's saying no. So how do we turn that down? How can we make that easier? Is that because there's a pain and there's a protective guard? Or is it just that it doesn't want to go there for whatever reason? So we can do some work in quieting down the lat as we start to get some external rotation or head overhead position. Maybe something else starts to show up of now there's a pinch here. Okay, a pinch is usually a joint problem. Let's look at that joint and see what's going on there. So for your shoulder, that was kind of what we were doing, right? Is hands on the lats, what's going on here? Hands in the subscap, what's going on there? Do you have the strength in these positions? So kind of looking at ideal shoulder health would have all of the range available and you would control all of it, and anything below that is something that we want to try and tease out with you.
Okay, yeah. And then you would kind of give me homework too for exercises to try to work on these things and improve in the meantime.
Exactly, and it's trying to pair that homework appropriately, right? So if it is a handbrake position, that's the body putting on a guard for whatever reason. And so it's creating safe positions where then you can teach your nervous system that it's okay, that you don't need that handbrake, right? So that's a lot of isometrics and maybe a little bit of concentric, and then eventually into eccentric positions where then you're taking that load and taking it through the range as it opens up. And so we typically want to find out if it is something like that. How do we teach a safe expression of it that the system will calm down and give you a little bit more? So if that's an isometric position and dosed appropriately, you'll see that that handbrake comes down and you'll be able to go farther into the range, and it may be weak there, so then you need to strengthen that, or it may just be totally in the clear.
You must see like people with jammed up SI joints and lower backs pretty often. That's probably pretty common.
Yeah.
I would get pain on my right side, but then I would go see you or someone else and they tell me, oh no, you're really jammed up on the left side actually.
Yeah, so with SI joints, it's important, right? Because they are a spot that needs to be very stable, but there is a minute amount of movement that's also required. And so the SI joint takes a lot of the load, especially if the hips aren't moving. So that's one of the first areas to go to is what are the types of movements that you do in the day? Okay, you're very diverse into squatting and things like that. Are your hips actually giving you all the range that they're supposed to? Because as soon as you need more and it's not there, the SI joint is going to take some of that load, as is the lumbar spine. You may get some shift in position and things like that. So it's checking out the hips to make sure that what type of squat are you doing, or what other types of hip flexion positions do you have that? And if not, is it because there's a rotational issue, or is it the hip flexion block, or is there an actual shift in kind of where your pelvis likes to sit and we need to kind of bring it back? And like you were saying, sometimes you'll feel the symptoms on one side, but the stiffness is actually on the other side. And so by making that side move better, you take out the strain on the other side. And you may see that as, watching somebody kind of squat and they've got a bit of a zigzag, or a lot of drifting, right? Or if somebody is going down into a position and as soon as they hit that block, they need more movement. Is that a translation forward or a rounding of the low back where you get that butt wink, maybe a bit earlier than at the very, very bottom, and things like that. So it's kind of looking for those individual pieces and going, hey, out of the 6 or 7 pieces you need for this squat, you've got 5 of them really well, but 2 of them need some work. And if we fix those 2 really specifically, the whole thing should look and feel a lot better. And those 2 things, or that one thing, may be very different from you than somebody else who has the same symptom in the same movement, but it's maybe their internal rotation is an issue on theirs, whereas one may be something more spinal or pure hip flexion or something actually at the ankle. And so, we've got these great movements that we've got the squat, the deadlift, the thing, and then we've got all these different bodies doing them. And they may have the same pain, but the trigger for it could be very different. And so being able to tease that apart is a pretty important piece.
Sciatica is a good example.
Yeah, is that a lumbar thing? Is that a glute thing? Is that a nerve tension test thing? Like what's causing that? Is there something else going on?
What would be your main advice or takeaway to give to, let's say, health professionals?
So sometimes it is as simple as that range of motion, of really getting a solid idea of what is happening during each piece and thinking of any movement that someone's doing as all of the individual articulations. So in a squat, you need a flat foot, you need dorsiflexion of the ankle, knee flexion, hip flexion. Sometimes there's a rotational component as well as some stability up top. And so it's really taking the time to assess each one of those and going, what's the passive component here? What's the active piece? And it's not always a flashy thing to do, but it can give you some of the most important information that I have seen missed sometimes quite a bit. And it can be as simple as, did you know your ankle does not move very well on here? And I know you're coming in for an SI problem, but you keep squatting or you need this position more times than you don't. And that actually could be the thing. And, or great toe extension, like sometimes it is these smaller pieces. And I think the other thing too is treat what you find and not what you think it should be. It's not always roll out your IT bands or something like that. It can sometimes be your great toe doesn't extend very well. You've got to just get that moving and this whole chain will look a lot better. And that can be sometimes an odd conversation to have when you're like, but the pain's up here. Like maybe we need to do some glute work or some extra SI mobs or look at the pelvis. If it's not there, it may not be there. And treat the thing that you see. Yeah, so let's look at a front rack position, right? Just because it talks a lot about shoulder external rotation and flexion combinations, and it's something that we see quite a bit when people are loading up. And if you're seeing, front squats like this, right? And we want external rotation, we want elbows really up, we want to load on the, onto the shoulder. And so really simple test for that, right, would be looking at someone's external rotation in flexion compared to, say, external rotation down. So somebody may have lots of external rotation down here, but as they come up into flexion, you may see that they get really tight. So if you've got a dowel or something that you can kind of wrap their arm around, right, we want to build what it is that we want to see in the ideal world with them. So, okay, so let's just bring your elbow up and let's keep it kind of in front of you, right, not out to the side, not down. Like, let's build that position and see, in isolation, what is your external rotation before you start looking to cheat somewhere, right? So some people, this may be their external rotation. They're actually partially internally rotated, right? They're not even really at that neutral line. So somebody like that is going to have a really hard time getting up into a front rack. So then it's looking at, okay, so where, if that's the case, where do you feel that? Is that some sort of huge stretch in the back, in through the front? Is there a jam? Does it just not want to go? And if it is really restricted down there, but totally fine here, where in that arc do you start to see it losing its ability to hold external rotation? So somebody may be really fine, and then really early you start to see them dipping down. So, okay, so maybe we actually want to go to where we were good and stretch down there and introduce the flexion over time. Or go in through there and see if we can start to externally rotate them. And what we want to see is, as they're going into those stretch positions, is there any pain? Ideally, we're not going to be pulling into pain. Is there a tightness that you can feel? If there is a tightness on what we would call like the open angle, and we'll show that kind of with overhead, it's really easy to show that, then that's going to be more of a muscular component typically, or a connective tissue thing, and you'd want to stretch that out. Whereas if it was a jam on the closing side, it's probably more likely a joint problem or a joint position thing that needs some attention. And then the other thing too, as you're finding those types of restrictions, is kind of dosing it appropriately with, is it just a hold? Is it a passive stretch? If it is, how long? Like, research is looking more at 2 to 4 minutes for long holds versus the 10-second holds or 30 that we were into before, right? Or if somebody can hold a position quite well and there's more of a weakness, then maybe we want to get them there and do more isometrics, where we can just block them and hold and do more time under tension. Are we building up to 3 rounds of 20-second holds with good effort, right? If they're starting that and they're fatiguing really early, at the 10-second mark, okay, then let's just do more of those shorter 10-second ones with the goal to build them up to, no, I can press really damn hard on this thing for 20 seconds while breathing and maintaining a conversation without any pain, and using that as kind of a metric of, do you have 20 seconds of good solid effort in that position isometrically? Dosing is very important. So is that difference of that open angle, closing angle. So like I said, like in an overhead position, the open angle is the one that is getting bigger. The closing angle is the one that's getting smaller. As we go into an open angle stretch, that's kind of the health, like that's the ideal. Oh yeah, I feel that in here. A hamstring is an easy one that most people will feel an open angle stretch, right? It's as you're getting farther into that hamstring,
dosing
you're getting the tension. If you're getting a jam, that's sometimes the joint getting tight on itself, especially if you get a pinch. That's not a tightness that you can foam roll out. That won't get rid of that. That's a bone-on-bone kind of articulation. So that can be caused by either your anatomy or just that something is sitting a little bit too tight and not giving you the range. So that's when maybe you're getting the bands out and you're doing more distraction type stuff, getting into those positions and having the humerus pulled down or up or over, and actually clearing the space so you can go up into those positions. If somebody did have a closing angle pinch in that position, but they were fine out, that's where we can start looking at just modifying activities, right? So instead of doing a straight overhead kind of maneuver, maybe they are doing something that's out a little bit wider where they're not hitting that pinch. And over time, they can come in farther and farther.
Narrower. Yeah, I get people to do the dowel passovers, one of the main warm-ups I do. and then try to encourage them. Like if that's starting to feel easy, go, narrower.
Yeah, because the amount of people that, they're, oh, I could do that, and then they go and, oh, hold on, and they have to cheat, right? They're bending, and it's like, no, go out wider. Okay, so that's an arc that works for you, right? We've got the ideal shoulder position, the elbow position, great. So now let's come in over time, like you said, and you'll see that adaptation. And typically, if it's all open angle kind of restrictions, you'll see that get better over time. And then if they hit a wall where, hey, this was working, and now I've got a pinch, and I just can't seem to get through it, cool, the problem's not that anymore. Now we need to do something different. More passovers won't fix that, or pass-throughs. We've got to do something else. With the deadlift, right, if you are looking for that depth and that position, you're seeing people that need to come down and then they're bending their back, right, and grab the bar, and then they're pulling from there, or can't get themselves kind of situated. That can be a number of things, right? Like, is that an upper back piece, right, of a fatigue, or they just need to use their upper back? Is there a depth that you can change of bringing stuff up for them, right? Because if they've got ideal shape, and then it's just at that last few inches to grab something, and you're just seeing that they're bending through their back, they may just need time to train there. So bringing them up a little bit higher for a while and bringing them down over time makes sense. But if, say, it wasn't that, say they were totally fine upper back wise, and it's actually a hip flexion issue. If they can't get into their hip flexion very well to the level that you'd want, so you can lay them on their back, and have a look at, hey, if your back's nice and straight, which it would be in a deadlift, we're not going to use your back. What happens with your pure hip flexion, right? If you're somebody who gets blocked, before 90, it's like, oh yeah, that's really pinchy in there, or really tighted through there, then you're not going to be able to put them on the ground or stand them up and get them all the way down into a deadlift or a squat if their hip's pinching. Now, they may be able to go out wider, so changing their exercise to match the anatomy and the movement that they've currently got would make sense. Maybe it's a sumo, maybe it's a wide squat, or maybe you're doing something with a bit more lateral play. If they're totally fine one side of hip flexion and not the other, then that's going to give them that one-sided thing, or you may see them kind of try and drift around that as they're going up and down, especially at the bottom. So if it is a depth issue, bring them up. If it's a hip issue, work on the hip, right? Like fix the problem that's showing up. But keep them training in the meantime.
I've tried using Romanian deadlifts. I find, personally, you're stretching and strengthening the hammies at the same time, and then eventually, some of them, this doesn't work on everybody, but sometimes you get people all of a sudden a couple months later they're able to do a deadlift.
Exactly, and that's probably where it was that open angle, right? It was that backside that wasn't able to go the full length or with the control that you wanted at length, because that's the other thing, is people may have the ability to hit the shape and the length that you want, but they may not be actually competent there. Their nervous system may need some time conditioning, whether it's reconnecting to that, when my leg's this long, I can pull with my hamstring, and look for shaking. That's one of the biggest things, is if you see shaking, that's a lot of neurological learning. That's a fantastic place to be.
Shaking good.
Shaking is good. At the zone of shaking, especially if you see a change in their breath, and you can, okay, that's the spot for you. Let's get this breathing regulated. Let's get that shake, and everything as you master that position will go down. The breathing will be normalized, the shake will be less, the effort will go up, the amount of force you could put against that effort, like increasing weight, will go up. They'll be able to maintain a conversation. If you put someone in a mid-range of something that they're really competent in, you don't see as much of that shaking or break. You put them in a stressful position and they start to, talking changes, breathing changes, and that's a really good place to be if you're trying to learn that shape. So the Romanian deadlifts is great, right? Because you are setting them up really nicely at the start and asking them to head towards the more challenging zone. And over time, that will condition out. If it was something that was strictly articular or strictly anatomy, it wouldn't change. You would see a stall, or you'd get them up to a point and then it would stop. And so it's, okay, so what are the tools that we have now that we've cleared that phase that we can go into? What's the block for you here? Internal rotation of the hip is a huge one. Internal rotation combined with hip flexion puts it even more in that closed shape, so that shows up really strong. And tibial rotation as well, the shin's ability to maintain internal rotation, are two that really combine a lot in terms of those squatting positions and people not being able to hit depth, or not being able to hit depth comfortably.
Yeah.
It's often you'll see a shin that wants to be out, right? Because you'll have people that really love kind of going through the inside of their foot. And that may also even go into a dorsiflexion issue. Like if their ankle can't flex and they can't go through their ankle, they're going to turn out and roll off of it and into the inside, right? Which then strengthens that bias for external rotation through the shin itself. Like your shin should be able to rotate out and in. And then continue that internal rotation up into the leg, into the hip, like you were asking about, the internal rotation. So being able to check someone's internal rotation, right? They can do that themselves. Again, are you really good down here where you can go in and there's not a lot of cheat, but then as soon as you come up here, you've got, nothing? Let's take the dowel again and do what we did with the shoulder. Let's put it on the outside, hook around, and check. Okay, how much internal rotation do I have at this hip flex position? We would expect to see more lower because we've got more slack in the joint, but how much can you maintain as you come up? And how high can you come up? Right? So if you're, somebody who's stuck there internally rotating and you've got none, that's going to show up in certain positions. If you're trying to do a really kind of, knees forward in squat, you need some internal rotation from there. They may really love stuff that's out wide. And so, so is this something that we're just going to hold for 2 to 4 minutes? Is this something we're going to add some movement in? Are we going to do some isometrics where we're pushing in? Do we need a band to actually help the joint itself? And what do we need to do with this? If we don't have a dowel or if we're just on the ground, can we use a 90-90 position to set up? If you're really tight, you may be off to the side. Yeah. If you're less tight, you can come up over time. And then can we actually start really dragging the body, into rotation to force more of that internal rotation? Now this one does have the leg more in that straight body position. So somebody who's super tight with internal can get a lot out of a 90-90 position. Somebody who's got great internal rotation when they're laying down and not so great when they're here, they need a hip flexion component of it. And so that's where maybe the dowel makes more sense for them. They may be really good in some 90-90 stuff because it's kind of more in line with their body, or they can start kind of bringing in the flexion and then trying to roll up. So if we want to look at dorsiflexion of the ankle, right, like bringing somebody up onto a bench or onto a box or anything like that, having the foot, really nice and straight along the bench, you can kind of really have a look at how far can you go, knees over toe, before you start to see, a lift in the ankle. Say somebody wanted to do a pistol squat. That takes a huge amount of range from the ankle, the knee, and the hip while maintaining that upper back position. And then it also takes, on the flip side, a lot of that long leg hamstring position. So say we were taking the pistol squat and wanting to break it down into those two pieces. Right? Can somebody perch? Can somebody get into this really closed position and balance on one leg? If yes, you've got one half of the equation. On the other side, do they have the ability to have that long hamstring position on the foot and cue it with that upper back position? Maybe not. Okay, so that's your half of the pistol squat to work on. In the meantime, how do we get around that hamstring piece but still train the pushing piece? So maybe that becomes, using this position and doing one-legged squats, pistol squat progressions where you can have their foot out underneath, right? And then going up. And then over time, very much like the Romanian deadlift, right? Like you can ask them to increase the area of work into the movement until, hey, we've got this. Now let's move you down lower, or let's move you right to the floor. Whereas if somebody was beautiful with the hamstring piece, and this was their dorsiflexion, well, is that a calf stretch for you? Like, is that something on that open angle? Cool. Over time, that'll work its way out. Is that a block in the front of the ankle? Okay, that's a joint thing. Do we need to mobilize that? If we do, does it change and open up range over time? Or are we hitting something that just, if it's going to change, it's going to be over such a long period of time that it's actually maybe more useful to switch to another movement, right? And appreciate just that's kind of where we're at with with the ankle. But if it changes with mobs or changes over time and they're happy to wait, then okay, pistol squats this September may be out. Yeah. Maybe this is a long-term 2 or 3 year kind of plan that we're going to put in.
Actually, a low bar squat might be perfect for them because there's much less
dorsiflexion needed, right? Yeah, or change what they're doing it on, right? So like you've got the wedge here, which is great, right? For being able to change that dorsiflexion requirement. So if you do have somebody who, say they can go just in front of their toes. Well, now if we do that and we put them just in front of their toes, this has got a lot more room to come down. You could get into a really nice back position, from here, right? Whereas if we were on here, that may end up, pushing them back too far, or they're in an awkward spot where now they're too much weight behind their center of gravity. So this can be fantastic. And you were saying, right, you've had some people graduate off and some people not, right? So over time training, right, we can get lower and lower and start getting them to the ground. And there's a good chance that was, open chain stuff or open angle stuff that just needed to condition over time. So when you can, encourage people to move away from it. And eventually, if they just kind of stall, then that's just where they're going to be for a while. Right, like looking at the levers and the available range, when you can kind of have a look at what shapes make sense for this this configuration, it can paint a picture for what types of squats work better. And there's some great videos. You and I have kind of looked at some of the similar ones and gone, wow, like a demonstration where we can kind of show somebody with long femurs versus shorter. Wow, that really changes the geometry here. And lifting's got a huge component of being able to lift along certain lines. And if your lines are longer or shorter, that will change how you interact with that shape. So, that could be, somebody with a really long femur, if we use this kind of line here, right? This has got a certain amount of depth to it, right? Like length. And if that works for the shape, great. If it doesn't, because you need them to be lifting from a different position, maybe your knees can't be in front of the arms in the movement that you're doing, then okay, can you offload to the side? Same femur, but now we've just changed the angle of it and we've cut a whole bunch of range requirement off this depth. So sometimes it is about where can we put this anatomy that allows us to do the thing we're trying to do, and that may be off to the side or farther in. Or creating some sort of other force on them, like holding a kettlebell out, helps people go into depth because it's dragging them slightly forward. And over time, do they either learn that themselves or do they constantly need that little bit of help because their lines are just too long for that position?
When I started getting into personal training, I spent a lot of time learning what a squat looks like, what a deadlift looks like. When I start to get people with like very long femurs or very long torsos, I'd be scratching my head, why does it look funny to me?
Yeah, some things can be so easy for one movement with one configuration, and then you ask them to do something slightly different, or another body with slightly different lines to do the same movement, completely different expression of it, right? Like high bar works really well with some people's back squat, and low bar works better for others. Is that because they've just trained to be stronger with that, or is there these levers at play? Sumo works really good for certain types of hips and femur lengths, and conventional works for others. And so being able to be flexible with your training and not go, nope, I only train low bar back squat and I only do conventional. No, like have those alternative options, and know, do you need to use one of those for an individual, or is it just a nice alternative where, hey, they can actually do both, so we're going to have both in their training. This person actually can't do this shape, but this is the same type of thing. We're going to do this because it works for them, and it keeps them engaged for longer because they're not running into a barrier that isn't them just working harder, right? And that's an important piece, is don't set people up to fail against their anatomy and their range, right? It's okay to challenge them into it and progress that, but if a shape just doesn't work or a position, there are so many ways to move in this world. Just find the other one, and it's it's not their fault. It's let's just match your body, your anatomy, your control with some sort of training goal, and they'll stay engaged with it and they'll see that progress, and